Hi John, how are you? Look, I'm Andy McPhee. I'm one of the neonatal consultants here, and I'm on this week, so I'm running the nursery and I'll be in charge of Danny's care, as it were. I just wanted to catch up today and bring you up to date on where she is. In the big picture of things, she's doing really well. A 28-week baby who's nearly 3 weeks of age. She's gotten over all the early lung problems that she had. She's come off the ventilator. She's tolerating full feeds of your milk and putting on weight, which is terrific. And her brain scans, which we do to make sure there hasn't been any injury, look great, including the one we did yesterday.
Yeah, it was really good to hear that was normal.
Yeah, that's a nice thing to sort of tick off the list, isn't it? Yeah.
It does seem though that her breathing's become a bit unstable over the last sort of few days.
You're right, John, and that's one of the things I wanted to talk to you about today. Just over the last 24 to 48 hours, she's been exhibiting some cardiorespiratory instability. You've probably seen that she has periods when she doesn't breathe regularly and her oxygen drops and her heart rate can drop. These are little events, but they just bespeak there's some instability there.
Okay, what can we do about that?
Well, this is almost certainly due to the fact that she's become anemic. She has a condition we call anemia of prematurity. And what we recommend as treatment for this is for her to have a transfusion of red blood cells.
Sorry, how does that help with her breathing?
The hemoglobin in the body, inside the red blood cells, is what transports oxygen around the body. So as the hemoglobin drops and the baby becomes anemic, it means the body's got to do more work to deliver oxygen to the tissues. And in prem babies, that's often revealed or becomes clinically obvious as this instability with their breathing patterns.
Okay.
So by giving her a transfusion of the red blood cells, we'll increase her hemoglobin level and increase her oxygen carrying ability, which will improve oxygen delivery to the tissues. And I'm confident that will help to stabilise this situation.
Okay, so the anemia is the low red blood cells.
Yeah, actually we have an information sheet here you might find helpful. We have this for parents when we're talking about transfusions.
Are there risks associated with a transfusion, especially for she's really little and fragile?
Yeah, she is, isn't she? Yeah. Look, there are risks with everything. Fortunately, in Australia, blood products are extraordinarily safe. With all treatments, we have to balance up risks and benefits. And overall, I think in this situation, the benefits of the transfusion outweigh the small risks.
What are those risks?
In broad terms, there's 3 risks. The first risk is the risk of a reaction of the baby's system to the proteins that we're infusing with the transfusion. They can be mild things like an increase in the heart rate or a mild temperature. But they can be more severe with rashes and even more severe effects on the body's systems. But in our experience, the likelihood of a severe reaction to the transfusion in the neonatal period is extremely unlikely.
But what happens if Danny is one of those rare cases and she does have a reaction?
Look, we don't have any tests that we can use to predict which baby is going to have a reaction, but remember that they're very, very uncommon. What we do is obviously to monitor the baby very, very closely during the transfusion. Danny's already monitored very closely, but she'll have an extra layer of surveillance looking for rashes and temperatures and so on during the transfusion. If we were to see a reaction, we'd stop the transfusion straight away and use some of the medications we use to reverse the process.
And the second risk?
The second risk is the risk of infection, but that risk is extremely low in Australia because of the very thorough donor and blood product screening that occurs. And then the third risk that you can see there is the risk that Danny receives the wrong blood. That's a procedural error, but we have very thorough and stringent checking programs which we go through right from the blood bank through the transfusion service to the cot side here. I think that likelihood of that also is extraordinarily rare.
It all makes sense and it's still really worrying.
Yeah.
Is there anything else we can try other than a blood transfusion?
Yeah, there are some things that people have tried over the years. There's a drug called erythropoietin which stimulates the bone marrow to produce red blood cells. That takes some time. It doesn't work overnight. And so we could consider that. It would take a while though to have an effect. Similarly, using iron will have an effect, but it's a slow effect, unlike the rapid effect you'd see with a transfusion.
So waiting's not really an option?
I think waiting, we simply run the risk that Danny's instability will get worse. I think this, a transfusion is the correct thing to do here, and I'm very confident that it will stabilise the situation. We discussed it at this morning's handover round, and we all agreed that Danny's situation fulfills the criteria and the guidelines for transfusion.
Okay, well, it sounds like that's the right thing to do.
Yeah.
I think we should go ahead.
Yeah, so do I.
Well, there's a consent form that I'll get you to look at, and we'll go through that and get you to sign.
Can you tell us a little bit more about the actual process?
Yeah, I'll go through step by step. Typically the baby needs to have an intravenous catheter put in to infuse the blood into the system, but in Danny's case she already has one of those, so we're already ready to go with that. The next step is that the blood bank will carefully match the right blood for Danny against her blood, and we'll send it here to the nursery. In the nursery here there's a whole lot of checking that happens to make sure that the blood that came from the blood bank is the right blood, and checked against the paperwork, and it's the blood that Danny is meant to get. Then the transfusion's given over a period of time, up to 4 hours, using one of the syringe pumps here, like she's having her other fluids. During that time, as I mentioned before, we watch very carefully with the monitoring we have. We also watch temperature and check her condition as well. I think through the process it's very, very likely that she'll be fine. But if you're worried about anything as well, then let us know, and we'll respond to that as well. Okay?
What happens after the transfusion?
Well, obviously we're going to watch, and I'm pretty confident we'll see increased stability, and we'll be able to continue her good progress. There's a possibility she may need another transfusion down the track, but we'll cross that bridge when we get to it, and she may not.
Will the transfusion affect Danny at all in the future?
Look, from what we know, there are limited long-term effects of transfusion. But if Danny ever needed a transfusion in the future, it would only be given on the basis of medical necessity. If she were to need a transfusion down the track, it would be appropriate to mention to the team that she's had this transfusion, because it may influence which blood they select.
Okay.
Okay, so any other questions?
I was actually wondering if I could give her my blood.
Yeah, look, the experience is that there's an increased risk of rare transfusion reactions when blood from relatives are involved. So we tend to discourage donations from relatives. And moreover, as I mentioned before, the safety of the blood that we get from Australian Red Cross lifeblood is very high, and the risks are extraordinarily low. So we do think that's the best option.
Okay.
Sure. All right, well, we'll get this ball rolling. If you have any other questions through the day, Satima and I are here, so is the rest of the ICU team, you know most of them. So if you do have some questions, then come and find us, and we'll go through whatever the issues are. Perhaps we might spend some time just going through the consent form.
When a blood transfusion is being recommended as a treatment option for a baby, it's vital for the parents or legal guardians to understand the benefits of and reasons for the transfusion, the potential risks of transfusion for their particular situation, any other treatment options that should be considered, and what is actually involved in the process. This discussion must be driven by the needs of the baby and the needs of their parents or legal guardians. Present information in a way that can be easily understood. Ensure that the parents or legal guardians' priorities and beliefs are taken into consideration, and recognise that these priorities and beliefs may influence decision making. Include the opportunity for parents or legal guardians to ask questions and have them comprehensively answered. And make clear that the decision for any treatment, including transfusion, needs to be made jointly between the parents or legal guardians and the medical team. Remember to give informed consent. It is essential that the parents or legal guardians must understand why transfusion has been recommended and what the other possible treatment options are. They must also be informed of the expected benefits and potential risks or side effects, and understand the process involved in giving the transfusion. This video aims to make clinicians, patients and parents or legal guardians aware of the information they should know when consent is being requested for a blood transfusion in paediatric or neonatal settings. This video is not intended as medical or professional advice. The disclaimer found at transfusion.com.au applies to this video.